Yeah, thank you. So now to the air out there. We are talking about worsening conditions. Dr. Vishisht Mehta joins us now. He is the pulmonary director with Mountain View Hospital. Good evening, doctor.
Good evening. Thank you for having me.
Thank you for joining us. So we smell it, we see it. What signs do you look for when determining whether the air out there is healthy?
So I think that's a great question and something that's becoming increasingly more relevant, unfortunately. First thing, at least around the valley, we can see the outline of our mountains start to fade, and sometimes patients with respiratory conditions may feel like they're having an episode or exacerbation of whatever the underlying condition is. I always suggest to my patients to keep an eye out on the weather, and the airnow.gov website is also a great resource. Prevention is always better than cure, so during wildfire season, to have this part of your routine, just like to check for your morning traffic, perhaps take a look and see what's in store so one can have a heads up, sort of.
Stay informed. Are you seeing an increase in patients now because of the conditions out there?
A few of my patients today were certainly complaining more than they would have ordinarily, and they could tell that, it's heading in the direction where they may need some extra help. And there's different ways to prepare for that and to mitigate that as well. But yes, I did have, at least today, more patients bring this up for sure.
Let's talk about who is most at risk. We can presume those on the front lines, but what about here in the valley too?
I think that's a great question. Usually in circumstances such as these, it's the very young, the elderly, and in terms of pulmonary conditions, patients with asthma or COPD. And COPD, emphysema, we can use interchangeably in this context. It takes not very much for somebody who has a compromised respiratory system to feel worse off than some of their family members or friends who are otherwise okay. Also, patients with heart disease. Heart disease can make it hard for you to breathe, and if this is an additional irritant, even if you don't have breathing issues, that can definitely make it harder. Patients who cannot get to cooling center if it's hot, and also have a hard time with turning on air conditioning or may not have filters, could be some that have a harder time than others in these conditions.
Well, these certainly are challenging times out there. Again, we can see what's out there. Hopefully conditions will improve soon. Doctor, thank you so much for joining us tonight, and take care.
Thank you.